Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The focus of this presentation is what is the optimal timing for getting your second booster vaccination based upon the age and immune system. So the best way is to just put down, if you get a COVID infection, this is what I put. After COVID infection, how long to wait before I get the second booster dose? So right there at the top, I see COVID booster shot guidance by cdc.gov. And when we click on that, we come to this page. And so this is what we see on this CDC website. As you can follow my arrow, CDC website, and this is where we get started. And I just put this one here, get started. Start off with age 50 years and older. Do you have weakened immune system? Say no. I received Pfizer Moderna vaccine 2 doses. Have you had any boosters? Yes. I had one booster. Which booster did you have? Say Pfizer or Moderna. Then it has been more than 4 months. Yes, because most people got it like professional, health professionals. We got it in last September or October or November. So I say yes, and here's what the response is. You can. This is a summary of your history, and here, if you're likely to be exposed to people with COVID, like healthcare professionals, or if you're traveling, or if you're meeting family outside the house, or on vacation, then I think you should be considering the second booster dose. However, if you had a COVID infection within the past 3 months, after you received the first booster dose, you can wait for 3 months up to get the second booster dose. The second booster dose becomes exceedingly important, especially during the fall when there may be new variants of COVID which can reinfect people. As a matter of fact, in fact, there are a number of cases of people having gotten COVID infection after they have been fully vaccinated and received the first booster dose, and also getting relapse of the COVID with a different variant altogether. So let's keep that in mind. Let's start over again and look at all these different age groups. And if you have a child 5 to 11 years old, what's the answer? Does immune compromised system? Say no. Which vaccine did the child receive? Let's say Pfizer, that's the only thing that's available. Right now, there are no indications for a second booster dose. They are not eligible for a booster dose at this time. So that's for ages 5 to 11. Let's go back here and look at ages 12 to 17. Immune compromised, no. 2 doses of Pfizer. Did the child had a booster? Yes. Then you say if the child had a booster, they are not eligible for the second booster dose. So between ages 5 and 19, they are not eligible for a second booster dose of the COVID vaccine. Let's start over again and look at the last group that is left, 18 to 49. Say not immune compromised. They received Johnson and this Pfizer or Moderna booster. Yes, they had a first booster. Say something. And so between ages 18 to 49, they are not eligible for additional doses if they had received the first booster dose. So please keep this in mind because it has a significant bearing on whether you should consider getting a second booster dose. But as I said, there are cases where people have relapsed COVID after the second dose wears off over a period of say 4 to 8 months. Let's start off with the last group, 50 years and older. And do you have weakened immune system? No. And let's say you received a Moderna or a different thing, booster, yes. First booster, you received the first booster, which is something, and it's been more than 4 months. And again, we come back to the first chart we had that you are eligible for vaccination, and you should seriously consider that if you are immune compromised, if you have high risk with multiple risk factors like hypertension, diabetes, heart disease, or kidney problem, along with if you're a healthcare worker working with COVID patients, then you should be eligible for the second booster dose. However, between the time you had your first booster dose and the present time, if you had a COVID infection, here it says you can wait up to 3 months before you get the second booster dose so that you're in line to have protection during the fall when a new bout of COVID may be sweeping through. But as you know, this is May 19, 2022. We already have a BA2 and BA12.1 variants of COVID, making up almost 45 to 47% of the COVID infections here in the United States. And these numbers have doubled almost in the past 3 weeks. So it makes a lot of sense to know when to get the vaccination. The best time to get the second booster dose is before you get the COVID infection. I hope this has been educational to you, and please do share this with all your friends and family members, and please do subscribe to our YouTube channel. I will see you in the next video. I am Dr. Nik Nikam from Houston, Texas. Thank you so much.